Care services at home. Module content. Module outcomes. Aim of the module. What does home care mean? Professionals. Services provided. Different types of home care. Health records. Oncological home care. At the end of the module, patients and their families know what home care means. Describe the main categories of healthcare professionals involved in home palliative care. Describe types of services provided by multi-professional health team. Describe types of home care. Describe what medical records are. About the necessary conditions to activate the oncological care home. Aim. In this module we aim to provide a picture on the subject, specifying what home care means, how many types exist and who can benefit from it. What does home care mean? Home care is a service that aims at responding to fragile people's health needs, non-self-sufficient individuals, the elderly, the disabled and minors who require care at home on a temporary or long-term basis, in order to manage chronicity, prevent disability and improve the quality of life. Home care may refer to care given only by professionals, formal care, or in combination with care given by a spouse or relative, informal care, personal care or housekeeping. In almost all EU countries, home care is located at the intersection between the healthcare system and the social system and has its own peculiarities within each. Professionals. The quality of the home care depends on professionalism and availability of the operators. The home care activities should be based on a multi-professional team made up of all the healthcare professionals, supported by volunteers. Categories of healthcare professionals. Physician and nurses. Qualified and trained for cancer care and palliative care. Psychologists and psycho-oncologists. Offer the patients and their family psychological support. Physician and healthcare team coordinator. Organize the assistance. Services provided. Healthcare. Medical visits, supportive therapies, intravenous or subcutaneous infusion therapies, parenteral and enteral nutrition management, paracentesis, oxygen therapy management, pain therapy, palliative care. Nursing visits, blood samples and biological fluids, simple and complex dressings, wounds, pressure injuries, neoplastic, vascular, post-actinic ulcers, etc., management of AIDS, central venous catheters, peripherally inserted central catheters, bladder catheter, etc., bowel function management, caregiver education. Psychological visits for the patient and the family during assistance, and with the family for the grieving process. Services provided. Social care. Housework, such as grocery shopping, cooking, cleaning, and administrative paperwork, for example, filling out forms and paying bills. Socialization activities. Support in personal care, help with bathing and dressing, etc. In many European countries, health-related problems are handled by the health system, while social problems are handled by the social security system. Some countries such as Denmark, Sweden, and Finland have recognized the benefits of a home care policy within a single institution. Different types of home care. Planned home care. Basic level of care, delivery of medical, nursing, rehabilitation services to assessing the patient's needs and identify the therapy. Designed for people who are unable to reach the place where they can take necessary. Usually home visit is limited in time. Types of home care. Integrated home care. Professional services of various types in an integrated set of multidisciplinary treatments. Dedicated to people who require continuity of care and planned interventions repeated over time. Various types of levels of care, depending on the increasing degree of intensity of care intervention. People with no specific criticalities. Patients with disease with high complexity. Patients with terminal illness. Family and caregivers. Health records. The medical record is a health document, where the patient's entire medical history is recorded, daily diary, reports of examinations and analyses, therapeutic plan, etc. In the daily diary, health workers record all the information regarding the patient's state of health, the therapies, tests and investigations to which the patient is subjected, as well as reporting the access of the operator who makes the home visit on that particular date. It is also possible to find the telephone numbers to refer to in case of need, medical guard, therapeutic referral, nurse, etc. The medical record should be stored and archived in protected places. Oncological home care. Home care is the most popular option for patients and their families. Numerous studies show that receiving the necessary care directly at home, surrounded by one's own habits and family members, has a positive effect on the course of the disease. This is why we try to avoid hospitalization whenever possible, to improve the patient's quality of life and make the experience as painless as possible, especially in the case of terminally ill patients and palliative care. Required conditions: verification of the presence of a valid family support, a suitable housing condition to ensure constant support to the patient, compatibility of the clinical conditions with the house.